welcome to the Healthy Joints, Healthy Lifestyle Show. And for those who don't know me, my name is Dr. Arinola Dada, and I help people with joint pain become pain-free. And welcome to our show. I am in the greater Seattle area, and I practice as a rheumatologist. So today I have the phenomenal Dr. Justin Putz, who is a rheumatologist in our clinic, and he has decided to grace us with his presence as we talk about that painful condition known as gout. Okay, Dr. Putz, welcome to the show. Tell us a little bit about yourself.
Hi, thank you very much. I'm excited to be here. I'm originally from Iowa, grew up in the Midwest, spent my adult life here in the greater Seattle area. My training, I went back to Iowa for a little bit, and then I did my rheumatology training at University of California in San Diego. But I'm very excited to be back here in the Pacific Northwest, which I consider my home, and love working at OAOC. This is a great opportunity, great city, best people in the world.
Even if you say so yourself, huh? I agree completely. So today we are going to talk to people about that painful condition called gout. So we're just going to start with, patient comes in with gout and they are like, they've heard of it. People have told them this must be gout. Like people easily make that diagnosis. What do you even tell them? Because like, well, why do I have this, doctor? What is gout?
So gout is one of the oldest diseases in medicine. Going back to the Stone Ages, people had gout, and so most people can recognize it. But like you said, it's hard to really understand it and be able to treat it well. And so gout, it's essentially an inflammatory arthritis. It's caused by a buildup of something called uric acid crystals. They build up in your joints that leads to very sudden, very intense swelling and pain. It's so painful, it hurts to move, even put on socks or touch the area very lightly is very painful. And having an early understanding and diagnosis are critical because the faster you start treating it, the more we're able to prevent recurrent attacks, long-term joint damage, and all of the sequelae that comes with that.
Yeah, that is so important. Because we're going to, just to piggyback on what you said, is that a lot of times people feel like when they think about gout in terms of attacks. They think about gout is, well, they have an attack, they did one thing, whether it's their diet or even moved from state to state or something good, something happened. And then they didn't have any attack for months, years, and they have another attack. And they kind of feel my gout was gone. What do you think of that? And then all of a sudden it's back. And then it's back, and then it's back. And they feel like in between those attacks that nothing is happening.
So I think it's important to understand that just like a lot of diseases in medicine, this is chronic. So just like high blood pressure, yes, you treat your high blood pressure with medicine and your blood pressure becomes normal, but you still have high blood pressure. Same thing with your cholesterol, same thing with your diabetes. Even if it's well controlled, you still have it. And so it's important to understand that yes, you have gout, and we can treat it very effectively. We have great options to do that, but it's going to be a lifelong disease process that we can control, like I said, very well, but it's never going to just disappear and go away completely.
Have you had any situations where it has gone away? Any situations that that you've come across or people have told you about where the gout has actually resolved completely?
There are some very rare situations where that can happen. Sometimes we're treating you for another disease in medicine, and it causes you to develop gout. Some chemotherapy agents, for instance, that we treat cancers with can cause that. And some medications we treat heart failure with in the hospital can cause that, where you have maybe a one time or for a couple of months you're dealing with it, and then that disease is treated and you're not dealing with it again. So there are those rare exceptions, but I would say for the most part, those are the exceptions and not the rule.
So so let's say, this hypothetical patient has come to you. We've kind of heard, hey, this is made the diagnosis of gout. Well, how do you actually make that diagnosis?
So the best and simplest way to diagnose gout is to see someone when they're having that acute attack. So when you come in with a let's say your toe is red, painful, swollen, you can barely move it. It's been going on for the past 7 days, and you're getting in to see us, and this is the very first time. Seeing that presentation, getting a history in the clinic, just talking to you in the physical exam. Is often enough in itself to make that diagnosis. However, that's not always the case. Sometimes you're coming in and the flare is resolved and you don't have those symptoms now, or you're partially treated and it's mostly gone, but now there's still a little bit of pain and things. So it's not always that clear cut. And in those cases, we can do things like pulling some fluid from the joint to check and see if there's crystals in there, or doing some imaging. Sometimes things like x-rays, if you've had it for a long time, will show us some changes from chronic gout. But some more recent advances in imaging have allowed us to do these very fancy CT scans where we can use a couple different scientific methods of doing the CT imaging to be able to tell us, hey, is there uric acid crystals in these joints or not? And the combination of those testing will help us point, is this gout or is this some other inflammatory arthritis?
Yeah, that's true. Yeah, we've come a long way in gout, right? We've come a long way in how to be able to identify gout and how to, and once we make that diagnosis, exactly like taking the fluid, analyzing it, or even using the fancy CT scan, we can really help people make that diagnosis early so that we can move forward with treatment. So on that note, so patient has come in, we've told them what gout is, we've told them how we're going to make the diagnosis, and I think we've made the diagnosis. And so the first question patients want to know is, what do I need to do about my diet? And do you have any dietary recommendations at all for patients with gout?
So yes, diet is definitely part of gout. I think that the most important thing is education based on what affects you. So we used to say, here's a whole list of all these foods that are high in purines. Don't eat any of these things. And by the time you get to that bottom of the list, you're eating nothing but water and crackers for the rest of your life, and then it's terrible. And so I think the important thing is for patients to be able to keep track of their symptoms. So know that, yes, these are the common foods that can cause gout attacks because they're high in a substance called purines. And so knowing that those things exist, and then when you eat them, if you feel fine, great, it's not a problem for you. However, if you eat something that's high in those purines and it does cause problems, then okay, I need to either avoid or minimize the amount I eat these things. And so, the really common ones are red meats, your beef, liver, organ meats, some of the shellfish, and then some of the often overlooked things, alcohol, so specifically beer, is very high in purines, and then in sodas. So non-diet sodas are very, very, very high in sugars that have a lot of purines in them. So those are the really big players, but there's a couple hundred different food items that all have high purines. And so you don't need to avoid them all, but knowing which ones affect you and limiting those is important.
Thank you. That is really a tricky area for a lot of our patients. They struggle with that. And thank you for kind of identifying. And we hadn't had this conversation before, but that's exactly what we both tell our patients. Apparently, it's, the high fructose corn syrup from your soda. You want to avoid high sugary drinks. You want to avoid beer. You want to avoid the shellfish. The organ meats. I haven't met a lot of people eating livers, even though I love liver. I haven't met a lot of people here eating liver and organ meats, but I still say it all the time. They're always relieved because they're like, well, I don't eat that anyway. So, and then you talked about red meat, and I really love that. The final ad you had is, yes, there's a long list because you couldn't find asparagus on that list of purines. Yeah. So it's keeping a food diary and seeing what really is your provocateur, right? What provokes gout in you, and that will really help you to kind of figure out, how your body is metabolizing a lot of these things. So thank you for that insight. Um, what would you say? So like, we still have this hypothetical patient. So hypothetical patient now kind of knows, hey, yes, there's this list from here to Timbuktu, but these are the things that I'm going to be watching for. I'm going to make a diary and I'm going to avoid like the top 5 things because we said those are no-go areas. Um, and then it comes to, well, how do we treat them? Right. It's like, okay, so what are you going to do for me today? Because my pain is 10 out of 10 and I can't think or sleep.
So I think the simplest thing is even before you come and see me, having a plan of what to do when you have a flare. So things you can do at home, as long as you have them. So ice packs, one of the simplest things we do. You can, if you have a red swollen joint, put an ice pack on it, and that can help in the short term. And also things, assuming you are able to take them. NSAID medications like ibuprofen, Aleve, naproxen, those are all over-the-counter things that you can do and before you get to see a rheumatologist. But once you come into the clinic, there's a whole landscape of medications we can do to help you get feeling better. More commonly, we use things like steroids. So prednisone, either in a pill form or sometimes an injection. If it's just one joint that's really, really causing a lot of pain and you want help right now, we can inject a single joint. And then there's other medications like colchicine is a very common one that we can give you to help get you through that acute flare. And then some prescription strength NSAIDs in some cases. So it's very tailored to your specific medical history and what you can and cannot take. But we have a lot of options.
Yeah, yeah, that's so helpful. And also it resonates when you said NSAIDs and then you said, well, NSAIDs, I'm sorry, non-steroidal anti-inflammatory medications like ibuprofen, just for our audience to understand what those are. But you said you may not be able to take them. So if you are a candidate for taking non-steroidal anti-inflammatory medications, they're helpful. What we find is a lot of people have been experimenting on their own at home and they've been taking a lot of ibuprofen, and what they've done is they started to damage their kidneys because every time they had a gout attack, they're like, oh, give me a bunch of ibuprofen, that's going to take care of it. Yes, it will, but a lot of people have ended up damaging their kidneys. So that's why Dr. Putz is saying, hey, let's make sure that you can take them. So I just wanted to make sure that that resonated with, our audience is, not everybody gets to take an NSAID, especially if your kidneys do have some abnormalities. So that's helpful. Like sounds like for an acute attack. Do you have any thoughts about a medication called Ilaris, which is like an interleukin-1 blocker? Have you had any experience with that for patients with acute gout?
Yes, so uh, just like a lot of diseases in rheumatology, gout has a lot of new medications that have come down the pipeline and new ways to treat this very old disease. And so Ilaris is a fantastic medication because it provides treatment right now for your acute flare, but also lasts a very long time in your system for months. And so you come in and get this medication in the clinic, and then not only, like I said, your acute flare over the next couple of days will dramatically improve, but then that provides you sort of long-term coverage for generally 3 or 4 months even of not having an acute flare while we help lower your uric acid with other medications to help control your gout in the long run.
Okay. And you brought it up. Control the uric acid in the long run. Okay. So how do we do that? So the patient has come, we've treated them either with the steroids, NSAIDs if they could take them, the colchicine or the Ilaris. Now they're pain free. What's next?
So the important thing is to know that any fluctuation in your uric acid can cause a gout flare. And that includes while we're bringing your uric acid down to the goal level that we want it to reach to prevent future flares. And so we keep you on some medication to prevent those acute flares, whether it's the Ilaris medication or if it's colchicine or intermittent use of prednisone or NSAIDs, whatever it may be for your particular case. And then we help lower that uric acid. So daily medications are available, things like allopurinol or febuxostat. In some rare cases, in older medicine, probenecid we may even use. These are all daily oral medications to help lower your uric acid. But sometimes that doesn't work, and that's not enough for patients, or they have a reason they can't take those medicines, or they've had a reaction to it, or they have a genetic marker that says, hey, I can't take this medicine. And in those cases, we have a medicine that can be infused every 2 weeks that you come into the clinic for, and that dramatically lowers your uric acid. So these pills take a very long time, sometimes years, to get your uric acid down to where we want to see it, in the 4 or 5 range. However, the infusion medication works very, very rapidly. Even after the first infusion, your uric acid can go all the way to 0, and it often does. And so we keep giving that to help your body reabsorb all of the uric acid that it's laid in those deposits over the years, and help you excrete it out in your urine. And it just sort of fast tracks your gout response and control of the disease. It's really fantastic.
Yeah, I mean, it is just phenomenal what, just kind of reiterating, what you said about just the advances that we've had in rheumatology, and specifically advances in gout. And I think that both for people dealing with acute gout, like you mentioned, and people dealing with chronic gout, there are treatment options for them, that they don't need to suffer. You don't need to suffer and live with pain anymore when you have gout. There are so many treatment options for patients. And then I guess the patient, this hypothetical patient, now has gotten their acute gout their treatment. They understand what the plan is for their chronic gout, but then they notice they have this big lump on their elbow. Do you have any thoughts of what that could be?
Yeah, so sometimes people who have really high uric acid for a very long time develop these deposits of uric acid under the skin. We call them tophi, and those take a long time to develop, but they also take a long time to go away. And so by maintaining your uric acid at a goal of a very low number, allows your body to slowly reabsorb those tophi. And so for the most part, they respond very well to urate lowering therapy, and we're able to get them taken care of. On a very rare case, maybe they're in a particular area that's causing so much pain, like on the heel or something where you can't wear shoes or walk. Sometimes we ask the surgeons to come in and remove those so that you're able to feel better faster. But for the most part, we're able to treat them with medications. But again, it takes a while, but we'll get there eventually.
Yeah. So, what would you say to someone who's kind of been dealing with gout and just has been reluctant, or just hasn't been able to, doesn't really see the reason why they need to do anything other than just take the ibuprofen that they get over the counter, and hey, the gout's going to be done. Usually it's 5 6 days, 1 week of pain, and then I treat it with this anti-inflammatory medicine, and it's gone, and it doesn't bother me again. What do you say to that person that really hasn't taken that next step in getting the care that they need to treat their gout?
Yeah, so there's so many reasons to get your gout taken care of. So, number one, nobody wants to go through these random cycles of pain. So you don't know when it's going to hit necessarily, and so you're about to go on a fishing trip, or you're going to go somewhere on vacation, and all of a sudden your gout hits. You don't want to deal with these random gout attacks that interfere with your life and lay you up for days at a time. Also, the more of these attacks you have built up over time, the more damage is being done to your joints. And like most of our diseases, once the damage to the bone is done, you can't get that back. And so it can lead to chronic pain, disfigurement, joint instability, and things down the road. And then even more importantly, I would say, than all of those things, is that we've learned over the past several years that every joint attack you have from gout increases your risk of coronary artery disease attacks, so things like heart attack and stroke, in the short period. So each attack increases that risk in the 90 days following that attack of having those events. And so it's even more important now to make sure that we have your gout under control, so that you're doing the best for you in the long run.
Yeah. Yeah, so you bring up an additional concern that people with gout may not necessarily know, is that it's part of this metabolic syndrome. Can you tell us a little bit more about that?
Yes, so when you have these inflammatory episodes in your joints, it releases a whole bunch of inflammatory cytokines in your whole system. So your immune system releases these markers that increase all of the inflammation, not just in that one joint. And that inflammation goes somewhere, and it often goes in the blood vessels, in the arteries of your heart, in your brain, in places that can cause real lasting damage. And so that inflammation makes those vessels weak. It can clog them. It can cause a lot of issues. And so the recent studies have shown that over the 90 days after an acute gout episode, you have a significantly increased risk of having a heart attack or stroke than if you didn't have a gout flare.
Wow.
So it's really important to prevent these gout flares if possible.
It sounds like it could be life or death to prevent this gout attacks, So yeah, it sounds like it's not just your joints. So
Yeah, so just like a lot of our diseases, they affect your whole body. So it affects your joints, it can affect your skin, it can affect your kidneys, your heart, your brain. There's a lot of areas that are affected by gout. So we're here to make sure we're health advocates for you and that you're getting the care that you need. But it all comes down to you in the long run. When you're having pain or you're having symptoms or you're having gout, come and see us and let us know so we can help get you healthy and taken care of.
thank you so much, Dr. Putz. I'm gonna would you mind leaving us with 3 tips? If you have that patient kind of coming into your office, what's 3 things you want that person to remember?
Number one is don't wait. So if you're having these symptoms, if you have gout, if you think you have gout, call us, let us know. We'll get you in, we'll get you taken care of. There's help available. That's definitely number one. Number two would be know that there's things you can do. So you can, we have medications, we have treatments. You can put some ice on the joint, take whatever medications have worked for you in the past if you're able to until you get in to see us, and then we'll take over from there and help getting you feeling better. And then number three is do the things that you can do to stay healthy at home. Make sure you maintain a healthy weight, limit your consumption of alcohol, don't smoke, and make sure you're eating a good diet.
Okay. Don't wait. Try the things I have tried before at home. Put ice on the foot and take care of yourself, right? Don't Healthy diet. Don't start smoking and minimize alcohol intake. Thank you so much, Dr. Putz. This has been really a really well-rounded talk on gout, and I think has really helped answer a lot of questions that we come across. And hopefully, this video gets liked, shared, subscribed to, so that this can be spread. If you know anybody out there, the audience, that is dealing with gout, do share this important information that Dr. Potts has shared. I appreciate you, Dr. Potts, for coming on the show, sharing these words of wisdom. You'd be surprised how many people it will impact and whose lives will be changed because they listen to you kind of break down a lot of the myths that are surrounding gout. Thank you so very much for coming.
Thank you very much. I appreciate it.
Okay. Bye, everyone.